Moxa works on a completely different level in the body, if you were to think of it in a Western medical way, than acupuncture does. So acupuncture, we're really working with nerve pain responses. When we insert, even if there isn't pain with insertion, it's a nerve response, helping the body to go from flight and fight into rest and relaxation.
I'm Michael Max, and this is Qiological, the podcast that curates East Asian medicine and methods through the power of conversation. As is usually the case, the first of what turns out to be a series of movies is usually the best, unless it's Star Wars, in which case, good luck beating The Empire Strikes Back. I loved the first of the Pirates of the Caribbean series. Captain Jack Sparrow is my kind of pirate, completely congruent with his lopsided wobble that we all have if you take a look close enough, and with a good dose of that madman mystic who seems perfectly fine and capable in whatever present moment he happens to find himself in. But even Captain Jack Sparrow finds that the direction of his true heart's calling, it's a mystery. And that's why he has a charmed device for navigation, a compass, one that points in the direction of his true calling and desire. We are such mysteries to ourselves. Who wouldn't want a compass that unerringly points you to the true north that your heart shen wants to go? There is an idea that tags along with Chinese medicine that we have a Ming, a life, and beyond that, a destiny. In fact, in Chinese, Ming, it's the same character. Let's pause for a moment and consider this. Life, destiny. Yeah, it's the same character. And this is where I want to be really careful because it's easy to overlay what I think in English on the Chinese here. It's inviting to riff poetically and perhaps a bit on the mythic about what it means that Ming means both life and destiny. Destiny. I want to pause for a second and invite you to consider for yourself what that means. Destiny. Is it a possibility that could arise depending on how you engage the opportunities of your life? Is it an already circumscribed outcome that you can't help but wander toward? Is it mutable or fixed? Predestined or predilection? Destiny. It sounds a lot like fate, which is another way that Chinese and English can easily misunderstand one another. In English, fate rather rhymes with doomed or predestined, while in Chinese, yuan fen, it's closer to opportunity meets willingness. There is a blend of agency and fleeting, potent moment. But back to Captain Jack Sparrow's compass, the one that points in the direction of his true desire. I bring it up because I'm so enamored with Captain Jack's capacity to recognize that his present conditions and circumstances are a fleeting moment in the vast tides and currents. They are nothing more than traces of wind on the water when you trust in what guides you to your Ming. So, destiny. Do you even need to work at it? Or is it a particularly pivotal moment, created as a possibility, but then you need the commitment of a choice that allows you to live into that potential? Does that make sense? And if it does, what would you name that which allows you to unfold the possibilities of your Ming? I've got a friend who says her hunches always work out. They might need months or even years to work out. And there are times when it seems things are going in the wrong direction, but in the long run, it works out. In this conversation with Maya Suzuki, we hear about her desire to learn acupuncture at an early age, and did eventually, but it was a longer and more circuitous route. And it also took her through becoming fluent in Japanese, which in turn opened the possibility for a more traditional way of learning the medicine. We're going to get into all of that in a moment. Stay with us. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out their new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear-Don't-Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lyle, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com, and where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AccuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit AccuFastNeedles.com. Your patients and the planet will thank you.
Welcome to Shop Talk. In this portion of the podcast, we are bringing you roughly 15 minutes of practical, clinical methods, perspectives, and advice that has its work boots on. This section is all about practical material that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, roll up your sleeves. Let's get to work.
Hi there. I'm Lisa Lapwing, and I'm super excited to be back on Shop Talk. In today's edition, I'm offering you pertinent questions I ask my male patients outside of our traditional 16. These questions are specific to the male physique and will provide you with valuable information to help you better understand what their body is doing so that you can make a clear differential diagnosis and appropriate treatment plan. These questions become important to ask when assessing patients who have come to you with conditions such as erectile dysfunction, premature ejaculation, BPH, prostatitis, or other andrological related issues. So you still want to be sure you take a clear history and background from these patients, asking them the traditional 16 questions. And we're going to use those in addition to these questions to create a well-rounded, comprehensive understanding of what these patients have going on. Before we jump into these questions, you need to understand that you have to be comfortable using specific terminology related to the male physique. If you're not quite comfortable using words such as penis, ejaculate, erections, prostate, intercourse, I highly recommend you practice with someone you are comfortable with. It can be hard at first to use some of this terminology, but the more you use it and the more you maintain your professionalism while you use these words, the easier it will become to ask these questions with confidence and poise. That will reassure your patient that you're professional and make them feel really good, comfortable, and confident with you. This is a sensitive subject. We really want to create some strong rapport with our patients. So let's dive into these questions. Important questions are, how often do you get erections? How often do you get morning or overnight erections? What is the quality of your erections? You can give them options on a percentage scale. Is it 30% of what it used to be, 50, 90? What is the quality of their erections? Are you able to have an erection to completion? That is, are your patients able to maintain an erection through to orgasm and ejaculation? Is there a difference in your erections between penis and vagina sex, oral sex, or masturbation? This question can give you a lot of information about their hormonal cascade based on what stimulates them. One of my other questions I always ask is, do you have pain with erections? I personally see a lot of patients for chronic pelvic, penis, perineum, and testicle pain. So it's a very important question to ask if you're seeing someone with any of these conditions. So of course, then I also ask if they have pain in the perineum, in the testicles, or in the scrotum, in the pelvis. Patients don't always understand the pelvis. That could be the pelvic bowl, it could be the hips, it could be the perineum, it could be more towards the abdomen, it could be more towards the back. So if they aren't quite clear, you can help by spelling it out for them that this is where the pain could manifest in these areas of the lower body. Another really important question to ask is, have they been given a diagnosis? Often, patients who are coming to you for these conditions have already seen a urologist, and it can be really helpful to know what diagnosis they were given, if they were given one. And if not, I do suggest at some point they do see a specialist, because a specific diagnosis can help you hone your treatment later on. Also ask your patients if they know what level their testosterone or PSA are at. And the answers to these questions become important if you're treating such conditions like BPH or prostate cancer. If you have a patient who has prostate cancer in their family history, PSA is something I suggest you recommend to them they keep an eye on. Another important question is, what is the color, smell, or consistency of the ejaculate? The answer to this question can tell us if there's possible prostatitis infection there. Another important question is, has any of the above changed recently? Has it always been out of the normal, or have you noticed recent shifts, pain that wasn't there before, discoloration that wasn't there before? You were getting nighttime erections, but now you're not. So you kind of want to jump back in with them and ask if any of these changes have happened in the last few weeks to the last 3 months. Look for patterns there. I also ask about discoloration, bumps, tender spots on the penis, testicles, or perineum. This again can lead us to possible diagnoses as far as varicocele, which is a varicose vein in the testicle, possible prostate cancer. So it's a really important question to include in your interview. You also want to know how many times a week does your patient ejaculate. If it's excessive or if they're ejaculate withholding, that's going to also give us a clearer picture to what's happening on a deeper level of the body. You want to ask them if they have had prostate stimulation or massage recently. Could that be the cause of something, pain or a change in sensation around that area? You also want to be sure to ask them if they have pain during or post orgasm. You want to ask if they have sustained injury to the genitals, to their spine, or to their hips. You think that this would be an obvious question that patients would answer, but believe it or not, patients are not always going to associate a back injury to dysfunction of their genitals. So it's up to us to do our investigative duties and find out if this could be contributing to their issue. This is a difficult question to ask, and you may not want to ask it in your first interview with your patient. It may come along a little bit later. They may also check a box in your paperwork about it rather than openly give you this information. At some point, if the information isn't readily given to you, I think it's very important to ask your patients if they have a history of sexual abuse. Now, you don't need to go into detail about them with that. If they offer it, okay, great. But unless therapy is in your scope of practice, just even knowing that they have a history of sexual abuse can help me formulate a diagnosis and treatment plan without knowing some of the upsetting details. Now, if they offer that up to you, okay, I want to say great, even though this isn't a subject we want the word great surrounding, but the details can, again, give you information on some of the psychological effects that they're dealing with that could be affecting their body. And just remember to remain compassionate, open, and empathetic. It's a hard subject to approach. And I will tell you, I have seen a large male population who has had sexual abuse in their past, and that is why they have come to me with various things like ED, premature ejaculation, pain in the penis and pelvis, and so forth. So it's out there. So if you choose to treat these things, chances are you're going to see it. One of my final questions I ask is, do you engage in sexual activity outside of what we would consider normal penis and vagina, oral sex, or masturbation? So this could be anal sex. This could be things where patients are using some sort of BDSM. So there could be a little bit more aggressive treatment of their bodies during sexual encounters. So that too will give you some information on how to treat their bodies. Again, it can be hard to approach patients with some of these questions at first, but you can always talk to yourself in a mirror, ask, a peer, a counterpart, another acupuncturist to get comfortable and really take a thorough look at the answers to these questions, as well as your basic questions you're going to ask them. I want to make note that also means it's really important to ask about their urinary habits, their bowel movements, because those things as well are going to affect the genital region. I've seen if patients have constipation, chronic, it can show up as pelvic pain or pain in the penis or testicles. And they haven't mentioned that because they don't make the association. So I'm struggling, like, why can't we nail this down? And then out of the blue one day, they're like, oh, yeah, well, I have chronic constipation. It's like, oh, okay, I asked you about that. You said no, but here we are. So the point of that, too, is keep checking back in, especially if you're treating a patient for something like ED. You want to continuously ask how often they're getting erections. Have those erections that maybe were missing overnight started showing back up again? What is the quality? Have we gone from 30%? Are we creeping up? Are we now at 40, 50% quality of erections through our treatment and or herbal program? So just like our other questions, we put everything together. We get this big holistic scope. We keep asking these questions, right? So we can properly track our patients' progress. And hopefully they're getting better. So when they are able to report to you, yes, this is getting better, that's encouraging for patient and practitioner. So those are my important 20 questions when you pull them apart to include into your patient intake interview when you're first seeing patients for common male andrological issues. Some of them I mentioned you may not want to spring on your patients that first appointment, but work them in as you get to know your patient better. For a more in-depth understanding on common men's health conditions, you can take one of my courses. I will have information on my upcoming courses on my blog at whole-healthacupuncture.com/blog. Currently, I have the date of 10/7/23, Saturday the 7th of October, set for my course, BPH and how to successfully treat it using TCM principles. The fantastic Florida State Oriental Medical Association will be hosting me. And as soon as I have the link to that class, I will put it up on my blog so you can sign up for it. Or you can contact me directly. I also offer consultation services, and I'm always here to just talk to other practitioners about this subject. I'm super passionate about it. You may have heard my geological episode with Michael Max talking BPH. I don't think there's enough education out there about it. I'm working to change that. So you guys can reach out to me anytime. I thank Michael Max for allowing me to be here, do my thing again, and I thank you all for listening and being fantastic practitioners of our beautiful medicine and art.
Maya Suzuki, welcome to Geological.
Hey, thank you so much for having me.
Delighted that you were here. I'm always curious about how people got into this stuff. This East Asian medicine. Especially for like Amerikanskis, grew up here on the continent. Like, how did you wander? You spent a little time in Japan. How did you wander your way over there?
Well, do you want the short version or the long version of that story?
I want whatever version you like to tell.
Well, I kind of knew I wanted to be in this medicine since a really young age.
How young is young?
Around 8 or 9. So I was born cross-eyed and had a lot of cosmetic surgeries to try to fix my eyes so they were cosmetically straight. And because of those, probably I had a lot of migraines as a kid. It was one of the few times that my good Jewish mother didn't try to give me medication, but instead she did acupressure on LI4. And it was absolutely amazing to me that putting pressure on your hand could fix you. And so around 8 or 9, I stole her book. I still have never read the book. I studied the pictures and would do acupressure on everybody who would let me and try to guess what was wrong with them. I was a really weird kid. And then eventually my dad met the clinic director of the school downtown who invited me to come get a treatment there. And I did. And I was like, screw acupressure, acupuncture is where it's at. And I was about 15, 16 at the time. And I graduated high school early and I was going to go straight into acupuncture school. And my good Jewish mother again was like, all right, that's good and dandy. Let's go have you get a real degree first. And then you can go do this acupuncture thing, And so I did. And I got a degree in Japanese and moved to Japan through that. And I knew that if I went into acupuncture, I wouldn't do anything else. So I played a lot.
You weren't going to come back.
Yeah, there was no coming back from acupuncture.
Once you go, you're not coming back.
No, and I did a lot of odd jobs in Japan. I worked for their government. I was an English teacher. I did a lot of different things. And then I had a really bad job that drove me into a pretty deep depression. And at the same time, I had convinced my husband's friend to become an acupuncturist, and he went for it. And I got really pissed off. And I was like, you're stealing my dream. You weren't supposed to take my advice. And so I actually, I was like, that's it. I'm going to do it. And my husband, then boyfriend, was like, well, why don't you go and get a job at a clinic and work 40 hours a week for a year and make sure this is something you really want to do before you spend that much money.
He sounds like a nice, good Jewish mother.
They actually match well. Yeah, so I took his advice and I went to a clinic in Japan called Acura Acupuncture Clinic. And I told Dr. Taikenjo, I said, hey, look, I will clean your toilets for free if you just let me watch. And he agreed. He thought it was a great deal. And so I worked as much as he would let me for months until I got like, $1.50 an hour. I got train fare and I was like, oh my God, I'm getting paid to do this. And eventually they helped me get into acupuncture school. The assistants and practitioners school helped me write my essays and prepare me to get into school and all of that. And went to acupuncture school there while I was working at Acura on and off. Yeah, in Japan. I went to a school called Toyo Shinkyu Senmon Gakko, which is in right near Shinjuku. It's in a station called Shinokubo in Tokyo. Yeah. And I kept working there at Acura. In the meantime, I found the group that I currently practice, the style called Iyashi no Michi, and got licensed in Japan, worked in Japan as a practitioner, and then through a series of events, mainly Fukushima power plant's explosion, kind of initiated the beginning of our move back to the U.S. So we moved back in the U.S. 2015. It took me about 3 years to transfer my license to the U.S. And when I moved back, I had to go to school here again, get my license here in the U.S. again, so take all the national
Did you have to go through the entire schooling again to do it?
Oh, thank God, no. Thank God. I ended up having to take 2 semesters, oddly enough, mostly clinical hours, because I didn't have enough supervised clinical hours for NCCM's requirements, which is odd because I had 10 years of clinical experience before I went into school. But
yeah, but it wasn't supervised, and gosh darn it, anyway, you weren't doing it in English, so you probably had to brush up your English a little bit.
Actually, so medical English, it was really hard actually initially. Most of my, well, definitely, everything to do with acupuncture, but biology, anatomy, physiology, all of that I learned in Japanese, not in English.
So I've got a question for you. When you first started practicing it in English, was it a little tricky because you didn't learn it or think it in English? Was it tricky doing East Asian medicine in English when you first started doing it that way?
So I actually, when I was in Japan, the clinic I worked at was, we had 70% fertility, 30% expat community. So I still had already had practiced working with patients in English. What was really difficult for me was having conversations with people like yourselves who are East Asian practitioners who have a TCM language that they speak in. And I don't know if you're familiar at all, but Japanese acupuncture does not exactly think or speak in the same way that TCM does.
It's a little different. They're like cousins from different, counties.
Yeah, and there's still places where I can't translate what I'm seeing in the client into that TCM language as well as I would like, to be quite honest.
Well, I wouldn't worry about that too much, Maya, because TCM is one way of speaking about it. It's a way that those of us that learned here in the States learned to speak that. I'm going to call it a dialect. But some things just don't translate, which is why you read them in the original language. It sounds to me like you may have aspects of how you work and how you think, and they just plain don't translate. That's not a deficiency. That's just the nature of things.
Yeah. I mean, I think it's because I do translate for acupuncturists wanting to learn Japanese acupuncture and moxa, and I do teach it as well, that there's this continual drive within me that if I can just say this better, if I can translate this better, that I maybe be able to transmit what's actually written in the Japanese language more effectively so people can learn it better, I think.
I suspect that you can, but I wouldn't worry about translating it into TCM. I would worry about translating it into a person's sort of palpable, knowable, livable experience, like translate it into how they think and how they are.
Yeah. I mean, that's what I strive to do, but you can always do better.
Translation is a tricky thing. Like, how much are you translating? How much are you transmitting? How much are you kind of speaking around it because you can't do it quite directly?
And I think too, at one point I was friends with a professional translator. That's all he did. And I think he said it really well, because I think all of us, we're learning this medicine, whether it's TCM or Chinese classical or Japanese, or Korean. We're learning this medicine really that originated in a language that's not our own. Except for perhaps 5-element Worsley, slightly different, perhaps. But, I think when it comes down to it, translating something word for word is not necessarily translating the essence of what's in those words and what those are trying to transmit, and there's so many different ways to say the same thing and to think about the same thing. And yeah, it's still, you can always strive to do better so that other people can study better,
It's a moving target. That's for sure. So before we jumped on this conversation, we were chatting for a few minutes, trying to get the sound right and all that. And you mentioned about how much you absolutely love moxibustion, especially for treating kids. Your eyes just lit up.
Yeah, I love all aspects of Japanese medicine, but I think moxibustion itself is it's just unfortunate because I think sometimes it's treated like the bastard child of acupuncture. It's not really given its due right in the medicine, especially in TCM education. And it's just so incredibly powerful, not only for kids, but for everybody, and there's just things that you can definitely do with moxa that you cannot achieve with acupuncture. So it's a magical substance.
I remember being introduced to moxa with that stinky cigar, crappy moxa. And here, this is going to help tonify, chi and blood and blah, blah, blah. And I'm thinking, this shit's going to give me cancer.
Yeah, it's funny. I teach a brief series of moxa classes at the local acupuncture school here in Colorado at CSTCM, which is really an abbreviated version of like the whole moxa instruction that I do within Shink University. And one of the very first things I do is I'll teach them half grain moxa, not rolling with boards, but actually rolling with your fingers. Because how I was taught in Japan, at least, the boards were originally created for patients to roll their moxa, not for the practitioners to roll their moxa. And so that's how I'm like, you're going to be a practitioner, you're going to learn this. And so I spend the first 2.5 hours of a 3-hour class or whatever, just working on that. And then for the last 15 minutes of class, we do pull moxa, and then we never do it again because it's so stinky and it's so ineffective. And man, it just smells really bad.
Yeah, it does. Agreed. And I was going to say, for folks like me who have bad lungs, it's just not doable. It's not sustainable in the long run. Now, you said you can do things with moxa that you can't do with acupuncture. And I suspect there's some acupuncturists listening to this that are rolling up their sleeves and itching for a fight. Like, oh yeah, show me. Tell me, first of all, how do you see moxa and acupuncture as being different?
Well, so I think it's stated pretty clearly. This is what my teachers always told me, that moxa is very, very efficient to move and to break down toxins, or doku, what we call in Japanese, deep within the body. But unlike acupuncture, you don't have to ever puncture the skin, even if you're just using shonishin, right, which is still on the surface of the skin. So I think that in itself is very unique. And then I think on the other hand, too, moxa works on a completely different level in the body, if you were to think of it in a Western medical way, than acupuncture does. So acupuncture, we're really working with nerve pain responses. When we insert, even if there isn't pain with insertion, it's a nerve response that we're getting, higher white blood cell production, a more efficient immune system, better blood flow to the area, helping the body to go from flight and fight into rest and relaxation. All of those systems are the same, but with moxibustion, it's actually happening through a heat shock protein response. So it's actually happening on a cellular level. And this is proven in Western science through some studies that were done over in Japan, that the cells themselves create this heat shock protein that initiates all of these things happening in the body and then increases. They've actually proven that, and I'd have to research for which studies they were because I learned it from a teacher over there, that when you use moxa, you actually get a higher white blood cell production than you would with acupuncture. So even in a Western medical sense, it's definitely more effective and it definitely has those reactions in different ways. And when I see it with my clients, it's just so difficult, I think, for most people to really, truly tonify with acupuncture needles. I think it's really, really difficult unless you're an amazing technician with your acupuncture. But with moxibustion, it's not as difficult because you're literally using heat, So, yeah, there's a lot of reasons, but it's definitely different as a substance.
In particular, kids and moxa. Is doing moxa on kids different than doing it on adults? Is there something different in the way that you work, or do you see different effects with children than you do with adults?
I don't know if this is particularly specific only to moxa, because I use moxa in combination with both shonishin, what I call acutherapy. For those of you who don't know, shonishin literally means acupuncture without the puncture. It's acupuncture for kids. So I use moxa in relation with shonishin, or with adults, I'll use it with my acupuncture needles. Saying that, though, I don't really think there's a difference between the moxa and the acupuncture. More so, kids in particular are just so much quicker to respond to treatment, I think would be the biggest difference. But I don't think that's specific to moxa. I absolutely love treating kids because they don't have the baggage that adults come with, there's no, like a prime example, like my daughter will come in and every little ache and pain that my daughter has, she'll come in and tell me about it. And she'll be like, Mom, my leg hurts right here. And I'll usually, if I'm in the middle of a day and, I have 4 kids and I work and I teach and all of this stuff. And I'm like, okay, whatever, let's just stick some moxa on it. And I usually just use the stick on moxa because it's easy and quick. And I'll stick on a cone of moxa and, 3 minutes later, she's like, oh, it's gone. And then she runs off and goes and plays. There's no identification, I guess is the best word, with the illness. Whereas I think when people get to the age of 12, 15, or maybe a little bit older, they start to really identify, like, I am Crohn's disease. I have Crohn's and therefore I am, whereas kids don't have that. A little baby with acid reflux and constipation will come in, and if the treatment works, it works. There's no mental to get in the way. So.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.com. www.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHEOLOGICAL for a 1-month grace period on your new Jane account. That's interesting. So, and I've heard other practitioners talk about this, and I've seen this in my clinic myself, where people come in and there's a whole story that goes with their air quotes illness, a whole story. And that story goes deep into their identity. Identity is such a big thing these days anyway, right? It's like the toxin of the day, it seems, actually. So I'd love to get your thought about like identity, like how we make an identity, how we make a self, how we make a story, and how that connects with problems that we take to an acupuncturist.
Well, I think, so my teacher, the main teacher of my group, Yashinamichi Yokoto Kampu Sensei, explains it really, really well in that he says, oftentimes if someone has a really difficult disease, sometimes he doesn't even want them to get a diagnosis unless he thinks that Western medicine can help them. And the reason for that is just what you were saying, because they start to latch on to that diagnosis and really like weave it into the fabric of their being. And unweaving that is so difficult. And I'm sure everyone who's listening has had this experience with a really chronic patient who has something that's really horrible for them and trying to unweave it. And, you know, something that I see often with my kid patients is that, for example, I have a young patient who got diagnosed with pediatric rheumatoid arthritis when she was 3. And she had constant pain until she came to see me when she was 8 or 9. And within the first treatment, I treated her where she tended to have pain, which was in her knee. And I was like, okay, how's the pain? Pain's gone. It's good. Her mom, though, was like, are you sure? Are you lying? Are you sure you don't have pain? You must have pain. So the mom, as the adult, had taken on this identity for her child and created this identity of her child as having pain all the time. Whereas the 8-year-old was like, pain's gone, I'm good, let's go. Let's get out of here. You know, and at this point in my treatment with that kid, it's almost more trying to convince the mother that the pain's not going to come back, because her kid has been pain-free, got released from her endocrinologist, you know, months ago. And now it's almost trying to convince the mom. And I think when we treat adults, especially with chronic illnesses, one of my teachers, when I very first started acupuncture school, one of the very first classes I took, they brought out all of the tools of acupuncture and put them on the table in the front of the classroom. And they asked, all right, what do you guys think is the most important tool in an acupuncturist toolbox? And someone's like, oh, it's the acupuncture needles. Another person's like, it's definitely the moxa. You know, we can't practice herbs in Japan, so they didn't say herbs. But, you know, another person's like, it's your hands. You need to have great hands to be an acupuncturist. And the teacher was like, you know what, you're all wrong. It's what they call your mouth needle. As the literal translation, they call it your mouth needle, which I think we would translate into English as the ability to talk to a client, almost therapy, right? Because that is really what helps to unbind that from their identity, is helping to convince them not only physically, but also through that emotional connection to unbind it from them, you know, and show them that they can be a human being without their pain and without their illness.
Being a human being without our pain. A lot of people come to us because of their pain. And rightly so. And acupuncture is famous for helping with pain. But so often the pain that people have, it's so core in some ways to who they think they are, that disentangling from that, now that leaves people really untethered in a sense. And as I listened to you talking about that young patient, her juvenile rheumatoid arthritis basically gone, not gone for mom. I suspect you see this a lot, especially with treating kids, that really you kind of have to treat the parent through the child. Is that Is that fair? Or is that just some cases or?
No, I definitely think it's fair. And, there's a lot of times when I tell the parent, hey, whenever you're ready to hop on my table, you let me know, because the parent needs treatment too. But, sometimes it's the actual physical act of treating them. For example, I have a client who wakes up 6, 7, 8, 9 times a night. And her mom came to me because she had, was developing postpartum depression. And the mom comes to me and I say, well, that's great, but I can't really help you until I help your kid sleep. I had to literally put my hands on the child to literally treat the parent in a physical way. And then I think there's times too when, again, you need to show the parent that their child can be a person without the illness, and that's very difficult for some parents because they've been dealing with problems since they were born. Baby went in the ICU the first day, had tubes sticking out of them for the first 6 months, and that's, I think, for adults becomes very traumatic for us. There's an idea in our medicine about the 3 causations of disease. Have you ever heard about this? Yeah, so there's like 3 main causes of disease that we learn about in Japanese medicine. So the first is inner, what you could call the what we do to ourselves, right? We eat too much, we eat too little, have too much sex, work too much, all the things that we do to ourselves, eat the wrong foods and all of that. Outer, you can't do anything about. Outer is trauma, right? You get hit by a car. You can't help that you got your leg broken and then you have depression because your leg's broken and you can't move. But the third one is what they call the neither category, but it's really emotional. The emotional causation of disease, which this whole industry of therapy and psychology has been created on, has been within our medicine for thousands of years and was actually considered the most difficult thing to treat of those 3 categories. This emotional causation. And, when we talk about this identity with our illness, I think we can't not talk about how that identity is perhaps feeding into the illness, perhaps causing other illnesses and other issues within the body. And then how do we also address the emotional through our actual acupuncture and moxibustion only, and with this mouth needle, the communication that I was referencing before.
I think that's such a great question. We have our own ideas of Western psychology and talk therapy and all that, which it's got its place for sure. But our job is not to be talk therapists in the same way that someone who's trained in psychology or psychotherapy is to do it. For sure, we have to connect with our patients. That's super important. That's vital. Otherwise, we don't know how to treat them. But it seems to me that we're working on a whole different level with emotions than simply, maybe that's being dismissive to say simply talking about it.
Well, I think it requires you to have the belief, perhaps, that emotions are not stored simply as a non-physical substance in the brain, but that emotions are stored physically as a presentation within the physical body. I mean, how many times, I don't know about you, but when I get stressed out, there's a little place in between my shoulder blades, right behind my heart, that always gets really, really tight. I call him my little drunk dude, that he just hangs out there. When I get stressed, he gets really angry. Like we all have our places. Like I got stressed out and my neck always hurts when I get stressed or whatever, or you have anxiety and you feel that tension and tightness in your chest, right? There's the physical presentation of emotion is something that our medicine can definitely address. It's, if you know how to address it, I think is the harder thing, really.
So how do we go about addressing it? Talk to me a little bit about the how.
Well, I mean, that's stylistic when it comes down to it, right? But I think it comes back to this really foundational idea, and that I was just talking at a conference at the local Colorado Acupuncture Association conference about palpation. and about how palpation can be so important. And I think in order to adequately address the physical representations of emotion or of anything really in the body, you have to accurately be able to palpate it, diagnose it, and then have the correct technique to approach it, right? And those three components, I think, are pretty foundational and central to all Japanese acupuncture styles, not only to the one I practice, Yashinamichi. I mean, that's the same for Japanese meridian therapy and any other style that I've really witnessed, actually. But I think the palpation in particular, and then this technique, is not as heavily taught or regarded perhaps in TCM, in most TCM that I've witnessed at least. I think the diagnostics are, man, TCM practitioners are amazing. Like, you guys can diagnose anything. You got that diagnosis down. But like the palpation, at least from what I've witnessed so far, and there's always variations, but being able to subtly palpate the Wei Qi all the way down to the nutritive, and all, understanding what cold and heat feels like, and what this idea of Japanese called jaki, which is sheichi or pernicious ki, what's also often written as an evil element in classic texts like the Shanghan Lun. Being able to palpate that and then address it with your technique and adequately address it so that when you palpate again, it's gone. I think that's really difficult, that takes time, a lot of practice.
I would agree it takes time and practice. And by and large, it's not taught in TCM because that's just, that hasn't been a piece of that tradition. There's other traditions, yes, but TCM, not so much. Would you say that any sort of emotionally induced, emotionally generated trouble that we store in our body would have a palpatory reference of some sort? It should be able to feel it.
I would say so, yeah. Yeah, I would say, the easiest one to think of is, again, that feeling of anxiety or nervousness, right? I think for most of us, I don't know, correct me, if you feel something different, let me know, but for most of us, we feel it in that upper chest from like the Ren 17 upwards, right? And for me, at least, it feels a little almost like fluttery, and anxious. I can't explain it any other way, but it feels anxious in my chest, like heat.
Yeah. No, but let me rephrase that. Is it something that you as a practitioner would be able to palpate?
That's what I strive to do. Yeah.
Fair enough.
Like if it was my teachers, I would say, yeah, for 100%. 100% that's what they can do. But at this point in my practice, I'm only, 12, 15 years in, like there's still so much I could develop, and I'm sure there's tons of stuff I miss.
How do you go about developing that palpatory, I'm going to call it vocabulary?
Yeah. I think initially, as with all things, you should find a good mentor that can teach it to you. Honestly, someone who will teach you not only how it's supposed to feel, but what you're doing wrong, what you're looking for, and then be able to correct you when you do it incorrectly, or, like you need that mentorship. But if you don't have that mentorship and you're just trying to go on it on your own, it's a bit of a princess and the pea kind of situation. So like I like to tell my students to take several different shapes of beans or, pencil lead and put them on the very bottom of a really thick book. Maybe you go to the thrift store or something and you buy a really thick book, put it on the very bottom of all of those pages, and then try to feel it through the top. So that way you can at least start to feel for a physical difference, right? And then temperature is so important, right? Because we need to understand so many things about the body. We need to understand not only the skin, which I think is often overlooked. For most practitioners, they don't understand the quality of the skin, the dexterity of the skin, the thickness of the skin, and how that presentation can be screaming at you where the patient needs to be treated. but then also thinking about the different temperatures within the body. For example, we have, I think you call it true cold, false heat, I believe, in TCM, right? And so there's heat on the surface. The surface of the, let's say, stomach is quite hot, but internally they're quite cold. And being able to feel, yes, the surface is hot, but internally there's actually cold there. I actually need to tonify, right? Or the opposite. And so feeling for that. And I think what more practitioners have experience with is feeling for, like excess muscles or knots in the muscle or ropey muscles. I think these are a little bit more easy for most people to practice.
For sure, those are quite notable. I mean, they're very objective and almost anybody could feel that. But you're talking about something far more subtle. And you just mentioned that you can differentiate cold underneath heat.
Yeah. And I wish I could claim that this is my invention. but to be honest,
well, of course it's not.
Yeah, it's I'm really not that special because I learned this in acupuncture school. I learned how to palpate for that in school. Palpation.
Yeah, you had good mentors.
Yeah. I mean, when it comes down to it, I had the teachers to be able to teach me. And, the first year I was in acupuncture school at Toyo Shinkyu, our meridian class where we learned the actual flow of the meridians, we had a book, but really we would go into the practice room and we would palpate the meridians from top to bottom, except for maybe like Ren 1 and Do 1. Like we didn't maybe palpate down there. That would be a little awkward. But, like palpating, like what does the entire liver meridian feel like? Where is its actual flow? Do I have the correct hand weight for palpation? Or am I just doing massage at this point? And then the points we learned as, again, an entire year-long class. The points we would learn every week we would have our point location class. And spleen 6, this is the point for Japanese acupuncture. This is the point for TCM. And this is the actual live or active point on the patient. This is where you should actually be needling. But this is where, they might test you on it. And understanding that difference, that was taught to me in school. So I was really lucky to develop that in a situation where everyone was learning that and the teachers were also doing that and treating that way. So I just I'm trying my best to just pass that information on if I can.
Well, I hear you talk about this. This is great. I've been in this business for almost 25 years now. It's as interesting today as it was when I first started.
I could geek out with you all day.
Yeah. And I just heard you talk about, like, we learn the liver channel by palpating it. Sure, you can look in the book and there's a line in the book and it goes from here to there and there's the bones and blah, blah, blah. And is that important? Yes, in a way. But I'm just thinking to myself, oh my God, what if I just took a day, or just like with each patient, like, okay, today on every patient, I'm just going to palpate the liver channel, just as part of my diagnostic, mainly because I want to teach myself, like, what's the liver channel feel like? Okay, now I'm doing the spleen channel or the gallbladder channel, whatever. I realize as we're having this conversation, Maya, there's a whole little bit that I could add to my initial diagnostic with people, simply for my own pure pork pleasure of, I wonder what the liver channel actually feels like. I heard Maya say you could palpate and learn about the liver channel by just palpating the damn thing. And I'm thinking, why don't I just do that? What a great idea.
I mean, it definitely makes your intake get a little longer.
Well,
but
I leave room for investigation in my practice.
Yeah. I think where it can get even more interesting is when you can take this idea of palpating the skin. And this is what I really love to do, is palpating the skin in relation to the sickness or illness or whatever's going on with the client, and looking on the skin for the different qualities of the skin. And perhaps because I treat pediatrics, this is where, a kid, you can't deeply palpate them. And a newborn who has issues with their spine, or, their head is not formed correctly or something, you can't push on that. But what you can feel for is those different qualities of the skin. Is the skin dry or rough? Is it thicker or is it thinner? Is it damp? Is it like rice paper and almost like feels like it'll tear? And all of these qualities. Is there heat? Is there cold? Is there that Jackie that I mentioned before? And then those places are just like, they're screaming at you, please come treat me. I'm different from the rest. And so for me, trying to find that place that's different from the rest it's like a never-ending puzzle game that I get to play. It's so much fun. And I can do it on every client, and they don't have to know that I'm doing it. But it's so effective and it's so easy.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital chi. And that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
So you're investigating the skin to see what's different from the rest. It sounds like a child's game. Which of these things doesn't fit?
Exactly. But I think this is one of the biggest places where I have a hard time, again, relating to TCM theory. Because for me, our medicine is so beautifully simplistic. My friend and one of my mentors here in the state, Jeffrey Dan, said it really well. He said, Japanese acupuncture is like a piece of sashimi or a piece of sushi. You can't get simpler than a piece of raw fish on some rice. You can't get simpler, but it's so exquisitely yummy and so good. And whereas, a really fancy Chinese dish is exquisitely complex, beautifully complex. There's so many flavors and tones and textures and spices, And I think that really translates well to our medicine, Japanese acupuncture is so simplistic. You don't have to have all this complicated theory to help someone make them better. You just have to be present and put your hands on and palpate and feel the place that's different from the rest.
I love the image of Japanese acupuncture as fine sushi, that there's a simplicity. And I had some Japanese acupuncture training when I was in school. We were introduced to a number of different modalities. And I've got friends that do Japanese acupuncture. I've always loved how that particular tradition touches more and thinks less. TCM in particular, very cerebral. And and depending on what stream of medicine you want to follow, you can do some very scholarly, cerebral sort of medicine. There's a place for it. I'm not saying it's wrong. But if you're just kind of a simple person and you don't do complexity well, which I would definitely fall in that category. I don't do complexity so well. I get confused quickly. When you start mixing up logical types and stuff, it's not easy. Being able to go to something simple that makes sense, going to what you feel or what you see. So with that in mind, Maya, any advice on how to stay simple and present and connected to touch? And more importantly, how we make sense of what we're perceiving? Easy question, right?
Easy question, hard to answer, honestly, because, I get this a lot from my students in Shinkyu, and they're consistently trying to move away from that cerebral TCM. But, that's where your foundation is. That's where you're going to feel comfortable, right? That's where you began, and that's your place of comfort. And I guess the best way I can give advice there, and this is what I tell my students too, is just treat what you see and see what happens. Just put your hands on the patient and treat what you see, and don't even think about it. Don't think, oh, they have this liver, chi, whatever, who cares? They have a stomach ache. What is their body telling you? What does their stomach say? What does their hara say to you? When you palpate the stomach meridian, what is it speaking to you? And then if you can't understand that, fine, how does the skin feel different? How do the muscles feel different, Yeah, it's really, honestly, being able to palpate and stay present and be with your patient and just treat what you see. It sounds super easy, but I think it takes a lot of people a lot of time to let go of being in their heads.
Spot on. Exactly. And this is one of the things that I have found over time, that in my mind, when I start thinking, oh, according to the theory, because I can make stuff fit the theory, it usually doesn't get me very good clinical results. When I think according to the theory, it means I'm lost. That's what I've noticed these days. And so, what I do, I go back to, what do I feel? What's the pulse like? What's the skin like? How come it's so soggy and gooey at spleen 9? Right? Or why is it so dry and tight at large intestine 11? There's all kinds of messages I can get from the body. The question for me becomes, what do I do with that? I can find and notice things. And I love that phrase about treat what you see or treat what you feel. The question I keep coming up with is, treat it in what way?
Well, yeah, going back to what you said, I think there's also, the Japanese acupuncture approach to diagnostics is flipped from the TCM. I've noticed in that with Japanese acupuncture, we take the pulse, we'll look at the tongue, more than likely palpate the hara or the abdomen, palpate the body. And once we feel what the body is saying, then we think, and we already have the points that we want to treat because we've already palpated. And then we say, okay, it is spleen qi deficiency, right? So that diagnostics comes last in the order of progression and really in the order of importance. Whereas TCM tends to be flipped, I think. Most people will take the pulse, get their diagnosis after listening perhaps to the symptoms, and then maybe they'll palpate for their points, or they'll just take their points and go. But, when you talk about okay, I've palpated and I felt, now what? This becomes, unfortunately, a very stylistic approach, right? Because I can tell you what I would do following the Yashinomichi theory and the Yashinomichi kata, but I think what you've studied is probably far different than what I've studied, and the style that you practice in and how you address, for example, what we call water toxin or damp in the body from my style is not going to be what your style treats. But saying that, if it feels soggy and damp at spleen 9, maybe you should tonify in spleen 9, And if it feels rough and excess.
Or maybe I should tonify something on the Yang Ming channel to dry out that tie-in.
See, and this is where it becomes very stylistic. Do you treat the yang to treat the yin? Do you treat the front to treat the back? Or do you go straight to what you're seeing and treat that? Or do you go to an empirical point and treat that through that? That becomes style. And so I can tell
guess
you,
it does, doesn't it?
I can tell you how I would treat it, but it's not necessarily going to be the answer for you.
I would love to know how you would treat it, though. Let's say you do find a very soggy, and we're just talking theoretically here. I just want to pick your brain and kind of see how your synapses work there. But you find a very soggy spleen 9. You look and you see there's other issues that have to do with accumulation of water, dampness, maybe some toxicity.
Yeah. Then what? Well,
yeah, then what?
So how the Yashinomichi kata is made, we first do our root treatment on a yin and yang point of the meridians of the arm. And so those points are meant to both start the movement for the issue in the system, but also to create an exit and entry point for ki to move through in case we mess up, which we all do it from time to time. And then usually we'll treat the chest, the belly, the yin and yang of the legs, then the back, and then the shoulders. And then we'll finish usually with a point on the legs. But if I have, let's say there is damp presentation, or what we call water toxin in the Hara diagnosis, let's say they have ringing in the ears, which is very common with water toxin, and they have dampness on spleen 9, I mean, sure, we could use the very common points of Ren 12 and stomach 36 and spleen 9, or maybe stomach 40, all those very common points that you would use in TCM. But really what I would do is palpate and find the most live or active point, right? If spleen 9 happened to be the most live active point on the yin channels of the legs, that would be the point that I treat, and I would probably tonify it. And then I would probably go, more than likely, to the stomach channel. If there's an issue with the spleen and all of that, more than likely to the stomach channel and find a live active point there. And so every point, we can have these theories of, I can use stomach 40 and spleen 9, and I can do this and that. But those are really like roundabout GPS coordinates for us to then focus our energy, palpate, find that live point that's actually saying, hey, please treat me, and then to treat. And so there's no hard or fast way, no point prescription. My friend Erlen Truitt, his teacher, said it best. The point in the book is good for the book. The point on the patient is good for the patient.
The point in the book is good for the book.
Yeah. I mean, it's not my phrase, it's not my saying, but I've totally stole it from him. But
it's so
true.
Good.
It's so true. You have to palpate. You have to find the point on the patient that's good for them, for what's happening with them. And, over and above that, it's just, not going to help that much.
So how do you find the live point? How do you know what a live point is? How does it tell you? I don't think it lights up with like a little LED.
That'd be so helpful if it did.
Well, it would take most of the fun out of it.
It would. Well, I mean, it comes back to your palpation, right? That comes back to palpation. And that, I like to split it up into two pretty stark categories just to make it easy initially. We have our excess point and our deficient point. And an excess point, it kind of feels like a volcano, like erupting, like ki almost feels like it's erupting out of the point. Whereas with a deficient point, it feels like a sinkhole. It feels like the ki is caving and it's just like trying to suck in energy and suck in and tonify itself, right? But if you got more complex, there's surrounding a deficient point, there's excess. Surrounding the excess, there's deficiency. That's so easy to think of when you have a broken bone, right? The broken bone is the definition of deficiency, right? Because it's broken, it's no longer strong, but surrounding it, all the muscles tighten and create heat and, pressure in order to keep the bone in place. So we have that deficiency and excess. So, you can get so complex with that, but really it's just trying to find the point that's either the most excess or the most deficient.
And treat accordingly.
Yeah. The technique comes with practice and, that's stylistic, but I don't know. It sounds like you have some history with Japanese medicine, but, technique in acupuncture in Japan and with moxa too, it is quite intricate. There's no, one of the biggest things that as a misnomer, I think with moxa in particular in technique is that moxibustion can only be used for tonification. which is untrue. It can be used for dispersion too, right? And it can disperse and then tonify, depending on your technique. And so can your acupuncture, but learning those techniques and figuring out which ones sing to you and which ones you love and which ones don't match your hands. And that requires, you need to get that mentor. It's just so important to have a really good teacher.
I love that phrase that you just said. Find the ones that match your hands.
Yeah. I think that's true of your tools. That's true of the style that you practice. That's true of the things that you like to treat, right? And you got to find what matches you.
I'm going to say yes, and for sure there's the things that match us and the things that resonate. Also, as practitioners, as people who are out to help people, probably helpful to go a little bit beyond what we're comfortable with. What are the other things that we can acquire that will allow us to be more helpful to more people? I'm not saying that we can do everything for everybody. I'm not saying that. I watch my own mind, and there's places where I'm kind of lazy, like, oh, that looks difficult. I don't know if I want to do that. Well, maybe I should learn how to do it because it would actually be useful for my patients, would be useful for me, and I'll develop something that I have potential for, but not at the moment capacity, and it's worth developing capacity.
You have so much more drive than I do. You're impressive. I usually let the universe bring that to me, to be quite honest. At my core, I'm a very simplistic, lazy person. And when the universe tells me, I am. And when the universe tells me,
really, you've got so much stuff up on YouTube. How can you say you're lazy?
Oh, you should. Yeah, I'm pretty lazy. I'm pretty lazy. No, usually when I need to learn something, I don't know if you've had this experience, but the universe will just start sending me patients that will force me to learn it. Whether I want them or not, whether I ask for them or not, it'll just start sending them away. And, you get that patient tennis elbow. And you're like, oh, I hate treating tennis elbow. This is the worst thing. It's so annoying. And then you get 6 more patients with tennis elbow. And eventually you're like, oh, I got tennis elbow now. And then it tells you, oh, you need to learn bloodletting better now. And, you need to learn bloodletting that happens on this really difficult place, and here's these patients to practice that on, so I just let the universe do it for me.
So the universe points it out to you, and then you go and learn it.
I'm kind of forced to. So I have to.
You could refer those people to somebody else. I've got people I refer all the time. I'll talk to them on the phone and I'll go, yeah, I'm actually not the best person to see, but I know someone who is.
I would say the only time that I really do that is when someone's going through medical fertility treatment. And that's simply because I don't have the current medical knowledge to really treat them adequately. So there's definitely times when I send people off to other practitioners when I think they would be better suited. But, there are times when and it's happening more and more lately that I get more and more difficult patients, more chronic patients, more patients that I'm like, man, I got no idea what's going on with you, but let's give it a good try, Mm-hmm. And my general rule of thumb is I tell my patients this all the time, I'm going to treat you, give me 3 times, right? Mm-hmm. And in 3 times, if we don't make a significant dent in what's going on for you, let's try to find someone who can, And so I'm really honest about that with my patients. And I think there are times when you do need to refer out. And I think there's times when you just need to do the work and get the skills, and.
Yeah, agreed. Absolutely. And I think that rubric of three treatments is pretty good. Why do I think it's pretty good? Because mostly people will give you 3 chances. And if you're not helping after 3, they're just not going to come back anyway. Yeah, they're not going to come anyway. So I think it's really useful, in fact, to say, I'm not sure that we can make progress on this. I've got some ideas. Give me 3 treatments. After 3 treatments, we'll know if it's helping, how it's helping, how much more you might need or not need. and we'll reassess there. I think people love hearing that because otherwise they're like, oh my God, how long will I have to see this person? And am I going to have to like ghost them to get the hell out of here?
Yeah. Well, and I think, giving your patients accurate expectations of your work, also something that I learned in school, but you really need to try to get what my teacher always told me, you need to have 70% efficacy with each treatment. Every treatment that you do, you want to get them 70% better. You don't want them more than 70% because then they're going to go home and the treatment's going to keep working and you might over-treat them if it's over 70%.
You sound so much like a Japanese practitioner.
Yeah, that's the magic number is 70%.
I think so too. I've had all my best teachers have said that.
Yeah, that's the magic number. And, they also said, if you can treat someone for 3 times and they come back for the 4th, then they are your patient. But if they come in once or twice and they don't come again, it's more than likely it's because you didn't help them, unless you were like, yeah, I helped. Okay, you don't have to see me anymore, which I'm not the kind of practitioner who sees somebody every single month just because I can. There's very few patients that I see on a monthly basis or a weekly basis that are maintenance treatment. I don't really like, it's boring. I don't like doing it, so I don't do it. It's boring. So
I thought you said you were lazy. Why wouldn't you want that?
Because it's so boring, man. Like, it's so boring. So boring. Like, there's nothing wrong with them. I'm like, why are you seeing me? I feel like it's just it's not an equal exchange.
It's not you. That's not the way you work.
No, it's boring. If someone's good, I'm like, come back when you got something for me. Until then, just do your thing.
Yeah. Yeah. Catch and release.
Yeah, exactly. But that 70%, but then also trying to say, give yourself 3 tries or, if you're less experienced, give yourself 5 tries or 10 tries, but be really upfront with your patients and say, look, for this kind of thing, usually it takes me between 3 and 5 treatments. This is how much I think I'm going to need to see you. Are you okay with that? And if they say, yes, great, then you've made a deal, and now they're in it. They know that you're in it to help them. And yeah, it's more mutual. There's more understanding. And I think that gets better results.
Yeah. And I think having that agreement that you're going to come back and discuss where they are and how they are 3 or 5 treatments down the road, it's very reassuring. It's like you're paying attention. There's all kinds of practitioners out there that would be happy to make you a patient for life. And some people might be looking for that, but a lot of people just want to feel better and get the hell out.
I 100% agree. And I know it's a much better financial business model to see the patient once a month, every month. But
I'm not sure it is.
I don't know.
I'm not sure that's true.
I know a lot of business coaches recommend that, but that's not how
They're business coaches. They're not acupuncturists.
Yeah, this is true.
Right? Because think about this. If you're really helping people, and you're helping them with things that no one else has helped them with, and they get better, what are they doing when they're not in your clinic? They are gossiping to their friends about you. And their friends are going to come see you.
Yeah. I don't advertise my clinic. I've only ever run 1 ad for my whole clinic. It's all word of mouth. I have a small clinic, but it's good size for me, and yeah, it's all word of mouth and it's so much easier. Again, I'm lazy. So, it's just so much easier. You get good results for your patients. They don't care if you're a doctor. They don't care if you see 60 patients a day. They care if the neck pain that they came in with is gone. So they can go out and, go dancing or play a golf game with their son. That's the important thing. And that's what I strive for, is to help my patients achieve those results so they can go live their life. I see them in the grocery store, I say hi. It's better.
You look familiar. How do I know you? Yeah.
I know you somewhere. Hi.
I know you somewhere. Yeah. Well, especially if you're living in a somewhat small community. I know there's HIPAA and all that. We have to be attentive. But look, if you're an acupuncturist in a small community, you're kind of a known quantity in a way after a while.
Yeah. Well, I live outside of Denver, 20 minutes outside of Denver. So a really big area. And I've really created my practice for the place for pediatrics to go to. And so no matter where you go to, even other acupuncturists are recommending their patients' kids to come to me. And so I think even if you're not in a small community, if you can create your practice as the place to go for pediatrics, for perinatal care, for, whatever, then that's the place that people are going to go to. That's what, you have to create that niche for yourself. I think that the days of being a jack of all trade and a master of none are over for our profession, unless you do live in a town of 300 and, there's no other acupuncturists. And then maybe you do have to be that jack of all trades. But, I think yes, you do need to be able to treat shoulder pain, neck pain, back pain, knee pain, all the top 5. And yes, you need to be able to treat, stomach issues and all of that. But I think you should have at least a place that you focus on for your practice.
Yeah, some kind of inquiry that enlivens you. Cool. Well, we're getting close to having to wind this thing down. I've got a new thing. I probably shouldn't say I've got a new thing because I've been saying that lately, but it still is a new thing for me at this point that I'm doing at the end to kind of wind things up, just to change the flavor a bit. Like after sampling a couple different wines, you want to have something to cleanse your palate with. I want to do a little lightning round, a couple of very quick questions, off the cuff.
Hopefully I can answer them. Well,
of course you can answer. You're a human being, and these might or might not have to do with Chinese medicine or Japanese medicine or whatever we call this stuff. All right, you ready? Here we go. What book are you reading right now?
Shanghan Lin.
There's a new Shanghan Lin out there. Did you get it? The new Eastland Press Shanghan Lin? Have you seen it?
I haven't seen that one. I'm actually reading and translating my teacher's version of the Shanghan Lin.
Oh, you're such a geek. That sounds great.
I really am. I need a pocket protector.
Okay. All right. What's your favorite movie?
Ooh, that's a hard one.
What about snack food while you're watching that movie?
Oh, definitely popcorn.
Oh, yes. What do you put on your popcorn?
Salt or caramel. Either way, I love it. No butter, though.
Okay. No butter?
No, I love the salt.
No butter?
I know. I'm kind of weird.
Okay. Well, yeah, you are, but you're an acupuncturist. All right. What should beginners ignore at the beginning of their practice?
Are they still in school or are they out of school?
They're out of school.
The theory.
So provocative.
I 100%. I don't think the theory is going to help anybody treat. I think your hands are going to help you treat. Treat what you see. Treat what you can touch.
All right. Maya Suzuki, I think that is a good place to put a pin in it for today.
Okay. Well, thank you so much for having me. It was so nice talking to you.
This has been a delight. The people that love us don't want to see us suffer. And so when we have some out-of-the-box idea, some inspiration that aims off the beaten path, or good Lord help us, a calling, then the people that care about us will get nervous. They don't want to see us fail or suffer, which is why it's generally a good idea not to share the big vision aspirations with friends and family. More often than not, they'll try to talk you out of it. It's hard for them to see the capacity that you might develop as you engage your big dreams. Cutting your own trail? It's not supposed to be easy. It's the obstacles and troubles that are the teachers. For sure, we're not capable in the beginning. Nobody is. But if you're tied to your North Star, then at least you know the direction that your heart wants to seek. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.